Arm contouring after major weight loss. Most of my patients who come to see me have a lot of skin of their upper arm. So most of them require a major arm. I'm going to address all the excess skin of the upper arm, but also of the underarm. At the end, we can provide a result like that. We have a really nice arm that fits her body, but also we want to tuck this in, and we can take away a lot of skin of the underarm. A lot of times I tell patients you'll never have to shave again. There are different approaches to major arm lifts, meaning where the scar is placed. And I do 3 of them, so I do all of them. There's the back of the arm approach, where the incision is on the back of the arm. There's an inseam approach, where the inseam of a long sleeve shirt will be placed. And finally, there's an inner arm approach, where the incision is placed along the inner arm. There's a reason why we pick one, and the main reason is, where is the skin hanging down from? If there's a lot of skin that's next to the elbow, then the best approach is going to be one that's going to get rid of all this skin next to the elbow and not leave a patient with a fullness. And so for me, that means that we need to use a back of the arm approach or maybe an inseam approach. The problem with the back of the arm approach, it's a little bit more exposed. If you're wearing a t-shirt, you might see the scar back there. Versus an inseam approach or an inner arm approach, most of us have our arms down. You're not really seeing it unless you bring your arm all the way up. But we cannot provide a patient with an inner arm approach if they have a lot of skin near the elbow. So it has to be the right amount of loose skin. So in her case, I could do an inner arm approach or an inseam approach. And we don't have to go on the back of the arm because for her, there's not enough skin that I'm concerned about near the elbow. And those are your options. Again, most patients require a major arm lift that involves upper arm, underarm, and then there's 3 different types of incisions. And again, the best option is going to be what fits the patient best, and also how do they feel about where the scar is placed.